We're joined by Dr. Jeff Golen from the UVA Department of Ophthalmology to speak to us about a new surgical procedure on our house call for people dealing with cataracts. So first of all, why would somebody need a corneal graft?
So the cornea is the front window to the eye. So there are a number of conditions that will cause the cornea to be less clear. In those situations, patients might need a corneal transplant. There are a number of conditions to include trauma, infection, and even conditions that a patient might be born with. All of these conditions could require a corneal transplant.
All right, and what about a Boston K-Pro graft?
So there's a special type of corneal transplant called a Boston K-Pro, or keratoprosthesis. The most common type used is the Boston K-Pro. This particular type of surgery is used for patients who have failed other types of corneal transplants and might not have any other options.
And what's involved with that procedure that might have a different outcome or a different result?
So that procedure actually utilizes a clear plastic material in the center 3 millimeters of the graft, and this allows the patient to have clear vision out of that central portion, even if the rest of the cornea is cloudy.
And is this relatively new? How is this progressed from the previous versions?
So the doctors at Mass Eye and Ear in Boston have been working on this for over 40 years. But in the last 10 years, it's made great strides, and these doctors have been working very hard on the surgery. So really, we've benefited from all their hard work.
All right. Appreciate your time this evening.
Thank you so much.
Thank you. Sharon?